Hey guys, Oscar here with Gastroenterology Simplified. I'm a board-certified physician assistant, and today we're going to be talking about esophageal strictures, specifically lower esophageal rings. Keep in mind that this video is for educational purposes only. If you have any questions or concerns, please contact your primary care physician or physician assistant for further evaluation. Esophageal strictures are the most common cause of esophageal dysphagia. What is esophageal dysphagia? Esophageal dysphagia is trouble swallowing, and the symptoms are felt around the chest area. Esophageal strictures could be secondary to an esophageal web, which is a cervical web, lower esophageal ring, or esophageal diverticula. Lower esophageal rings, or Schatzki rings, are known as the most common cause of intermittent esophageal dysphagia. It's also linked to poorly controlled acid reflux or persistent acid reflux. It's also known to be more pronounced when the patient is eating very fast and is not drinking enough fluid. The patient will tell you that they feel like the food gets stuck in the esophagus, but if they drink some fluid or plenty of fluids, eventually it will go down. The patient may also feel nauseated, but no vomiting. How are you going to diagnose it? You're going to get an esophagram with a tablet, a barium esophagram with a tablet, and this will give you the answer. It will show in the esophagus, it will show where the issue is at because the tablet will tend to get stuck or slow down at that specific area, and the radiologist will give you the answer. Now, how are you going to treat it? You're going to get an upper endoscopy, and the upper endoscopy will go down the mouth, through the esophagus, to the stomach, and you're going to introduce a balloon. The balloon is introduced through the mouth and then all the way to the esophagus, and it will dilate or rupture that lower esophageal ring. Now, that is the treatment that will fix the problem. But keep in mind that the lower esophageal ring, Schatzki ring, is linked to poorly controlled acid reflux or persistent acid reflux. The patient will likely need an acid-reducing medication for a few weeks to treat the symptoms and to help with the healing process, but to prevent it in the future, the patient will need a GERD-friendly diet, which consists of avoiding fatty foods, greasy foods, fried foods, spicy foods, caffeinated drinks, just to mention a few. In conclusion, a lower esophageal ring, or a Schatzki ring, is the most common cause of intermittent esophageal dysphagia, which is trouble swallowing. It is also linked to poorly controlled acid reflux or persistent acid reflux. The way to diagnose it is to obtain an esophagram with a barium tablet, and the treatment is to obtain an upper endoscopy, which will introduce the camera or the scope down the throat. At the same time, the endoscopist will place a balloon, dilate the ring, and it will rupture the ring, and that will fix the problem. But keep in mind that the ring is usually linked to poorly controlled acid reflux. So the patient will likely need an acid-reducing medication such as omeprazole, pantoprazole, just to mention a few, for a few weeks. And in the long term, to prevent the ring from coming back, the patient will need a GERD-friendly diet, which avoids fatty foods, greasy foods, spicy foods, caffeinated drinks, just to mention a few. Guys, if you found this video helpful, click like, subscribe, so I can bring you more videos like this. If you think anyone could benefit from this video, please share the video. That would be amazing. Lastly, have an amazing day, and I will see you on the next one. On the next video, we will be touching esophageal diverticula. So subscribe so you don't miss that video. See you on the next one. Bye.